Today we will be discussing hyperkinetic dysarthria and how to treat it. The definition of hyperkinetic dysarthria is defined as too much movement, and it's linked to damage to the basal ganglia and the basal ganglia control circuits. It's important to know each type of movement disorder is distinguished by different motions that are involuntary. The following are various causes of hyperkinetic dysarthria: chorea, dystonia, essential tremor, myoclonus, tics, strokes, degenerative diseases, infections, traumatic head injury. And even though these are all causes of hyperkinetic dysarthria, today we're going to mainly focus on chorea and dystonia.
Before we discuss treatment of chorea, it is first important to note that chorea is a movement disorder. It is well known for its involuntary and random movements in the individual's limbs, trunk, head, and neck. These individuals' movements are best described as being dance-like. It is important to note that the movements of these individuals are best classified as abrupt. There are two types of chorea: Sydenham's chorea and Huntington's disease. Additionally, it is important for a clinician to know that if a client is taking antipsychotic medications, the client can be diagnosed with tardive dyskinesia. The following are speech characteristics of chorea: voice stoppages, excess loudness variations, prolonged phonemes, intermittent breathy voice quality, variable speech rate, prolonged intervals between syllables and words, inappropriate silences, and rapid, brief inhalations or exhalations of air.
Next, let's discuss the key evaluation tasks. I would like to introduce Caitlin and Chelsea. Caitlin is playing the role of the client, and Chelsea is playing the role of the clinician. Caitlin and Chelsea will now demonstrate what these therapy techniques might look like. First, vowel prolongation.
Caitlin, I would like you to take a deep breath and say ah for as long as you can while I time you. Very good.
Next, alternate motion rates.
Caitlin, I would like you to take a deep breath and say pa-ta-ka for as long and as fast as you can. For example, padaka, 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 padaka.
Padaka, 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 padaka.
Next, conversational speech and reading.
Caitlin, read this passage to me.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow.
It's also important to note that with chorea, Chelsea will pay close attention to Caitlin's involuntary movements during each therapy session.
Next, let's discuss the various treatment options of hyperkinetic dysarthria. Botox is the most successful form of medical treatment for hyperkinetic dysarthria. Another type of medical treatment is pharmacologic. For this specific type of treatment, the client is given medications that are able to suppress their involuntary movements. Another type of medical treatment is deep brain stimulation. Deep brain stimulation is when an electrode is implanted and functions as sending an electrical impulses to various parts of the individual's brain.
When discussing Huntington's disease, it is vital to note that there are various behavior techniques for treatment that are stage-specific. The first stage is classified as the early stage. During this stage, it is important for the clinician to help the client maintain both normal prosody and optimal rate. The second stage is classified as the middle stage. During this stage, it is essential for the clinician to specifically target the following: the client's rate of speech and the breathing. Additionally, the clinician must ensure the client is speaking immediately on exhalation. If the client is not speaking immediately on exhalation, it is pertinent for the clinician to point this out to the client.
In the later stages of the client's life, he or she will most likely have progressive dementia. During this third stage, it would be vital that Chelsea work closely with Caitlin's caregivers during this difficult time of the client's life. Next, let's talk about dystonia. Dystonia is best described as hyperkinetic movement disorder, specifically affecting an individual's muscle tone. Dystonia can cause long-lasting muscle contractions that are involuntary. These lengthy muscle contractions interfere with the individual's typical movement. Even though dystonia and chorea both fall under the umbrella of hyperkinetic dysarthria, it's important to note that one distinguishing difference between the two is that dystonia is classified as more of the client having a slower and more nonstop or continuous quality than chorea.
The following are 4 types of dystonia: focal dystonia, segmental dystonia, generalized dystonia, and hemidystonia. It is important to note that dystonia is categorized by the sum of affected body parts in these individuals. There are 4 main causes of dystonia, and they include the following: spasmodic torticollis, drug-induced dystonia, Mage syndrome, and last but not least, spasmodic dysphonia.
Next, I would like to inform you of the speech characteristics of dystonia regarding the 5 subsystems. First, let's start with respiration and resonance. These 2 subsystems are not as affected as much as the other 3 subsystems. Next, articulation. These speech characteristics include the following: imprecise consonants, distorted vowels, irregular articulatory breakdowns, prolonged phonemes, and next we will discuss prosody. These speech characteristics in an individual include the following: monopitch, monoloudness, inappropriate silences, shortened phrases, and lastly, we'll discuss phonation. These speech characteristics in an individual include the following: harsh vocal quality, strained, strangled quality, and excess loudness variation.
Key evaluation tasks are similar to those when evaluating chorea. With the exception of when evaluating chorea, remember that Chelsea also observed Caitlin's involuntary movements. First, let's begin with vowel prolongation.
Caitlin, take a deep breath and say ah for as long as you can while I time you. Very good.
Next, alternate motion rates.
Caitlin, take a deep breath and say pa, ta, ka as loud and fast as you can for as long as you can while I time you. For example, puttica, puttica.
Okay. Puttica, 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 puttica.
Very good.
Lastly, Chelsea will have Caitlin participate in conversational speech and reading.
Read this passage to me.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow.
Very good.
Just like chorea, dystonia can be treated 2 ways, medically and behaviorally. The most common form of treatment for dystonia is drug-based treatment. Additionally, it's important to note that Botox is most successful for treatment of this disease. Lastly, deep brain stimulation can also be used. Behavioral treatment for dystonia involves 3 different strategies. First is sensory tricks. These are idiosyncratic strategies that can reduce a client's involuntary movement for a period of time. Next, we have bite blocks.
Take these, put them on either side of your jaw, and bite down while you talk.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow.
Very good.
Clinicians have a client use bite blocks because they are used to stabilize the client's jaw during speech. Lastly, the clinician can teach the client early onset of phonation.
I want you to try talking after you've just taken a deep breath.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow.
Thank you.